Welcome to the checkup. I'm Gabriel Perna, Deputy Editor of Digital Health Business and Technology, a brand under Modern Healthcare. I'm joined today by Marc Miller, President and CEO of Universal Health Services. Miller has had a long career at UHS. He started at the company in 1995, worked his way up to president in 2009, and was appointed CEO in January 2021. He leads an expansive operation that includes more than 400 acute care hospitals, behavioral health facilities, and ambulatory centers, and employs 89,000 individuals across the US, Puerto Rico, and the United Kingdom. Miller also serves on the boards of the Federation of American Hospitals and Premier Inc. Most recently, Miller was included on the Modern Healthcare Most Influential list at 49. Marc, thanks for joining us on the checkup.
Thank you, Gabe. Glad to be here.
So, Marc, recently you guys partnered with venture capital firm General Catalyst. Talk a little bit about that deal and why you thought it was necessary to partner with General Catalyst.
So General Catalyst has made it a priority in the last, let's say, 5 to 7 years to utilize a lot of their skill set. And they've done a whole host of different things previously, but to utilize that skill set to try to bring improvements to healthcare. All healthcare, but specifically, they also have a large interest in behavioral health and mental health care. And so it was a natural for us, as we started to speak with them years ago, to try to see what things we could do with them as they try to be as innovative as they can in a sector that has lacked innovation in the past.
Yeah, I'm glad you said that last part, because healthcare has often been criticized for not being the most innovative industry. How much disruption, how much innovation in healthcare needs to come from non-traditional players like a venture firm, General Catalyst, or a big tech firm? We've seen a lot of that. How much of that needs to happen from non-traditional healthcare entities?
I think a tremendous amount, because it's obvious that without the outside expertise coming in, we're not going to do it ourselves. We have made in the healthcare sector, and certainly the hospital industry, small steps over many years, but to really advance in ways that we want, we need outside help. And a lot of people use the word, use disruption, because so many industries have been disrupted. For us, it's a lot more about catch up. Catching up to a base level as opposed to really significant disruption. And then maybe we get to that point.
What's an internal tech project that you're proud of completing at Universal Health Services?
I mean, there's been a lot. I think some of them are smaller in scale, but at the same time, they've helped our operations. So technological use in areas like intake, where we weren't doing it before, and that's on the behavioral side. The acute care side is ahead of behavioral. So, and I think a lot of it just has to do with the acute care side is so much larger, the industry, than the behavioral industry that you have had for many years. Many outside players who have developed different ideas and applications and products for the acute care sector, whereas that has not happened on the behavioral sector. So, you just look at an electronic medical record. The government plowed, I think it was $18 billion into that effort many years ago to help fund EMR on the acute care side, but for mental health, we didn't get anything. And so most behavioral hospitals, just about every behavioral hospital outside of an academic center's behavioral unit that might be on their acute EMR, does not have an electronic record. Since we're the largest behavioral provider in the country, we thought it was incumbent that we try and lead that effort. And so we're undergoing that right now. We've started with a few of our facilities, and we're going to continue to roll this out. But it's challenging because we have to pay 100% of the costs for that. So it's a large endeavor for us, but that in and of itself will be the largest, really technological advance that we've seen in behavioral, probably definitely in our history.
Let's talk about that behavioral side because that's a huge part of your footprint. I know it spans 39 states as well as Washington, D.C., Puerto Rico, and the UK. Access to mental health services is a huge challenge everywhere you look. I know I saw a stat from Kaiser Family Foundation that more than 150 million people live in a designated mental health professional shortage area, which is a pretty staggering number. From your perspective at UHS, how has COVID exacerbated this mental health crisis?
I think there's a few things that have exacerbated the crisis. I think COVID absolutely has created an increase in need, really for every sector. So, starting from very, very young children who were taken out of nursery school and lower, lower end educational opportunities to all of our kids up through high school. But then you get people in midlife as well as geriatric patients. There are so many things that people are dealing with. So I think that COVID has been very detrimental in a lot of ways. I think equally so, if not more so, has been the prevalence of so many of the online social media aspects that have affected, especially children. We treat a lot of children. Our behavioral sector, behavioral division, treated over 700,000 patients just last year. And that number continues to go up. And the prevalence amongst youngsters under 18, and clearly not just teens, but folks in their 20s as well, continues to rise. And we think a big part of it has to do with the phones and the social media influence on them and how people are dealing with it or really are not equipped to deal with a lot of the challenges that comes from those things.
What are some of the strategies UHS has begun to deal with this challenge? I know you've done a few joint ventures with other behavioral health hospitals. Talk a little bit about that and some of the other initiatives that you've begun.
Well, we certainly feel, as the largest provider in the United States, and actually I think we're the largest in the UK now as well, that we have an obligation to try to help and serve patients further than we were previously. You mentioned the 39 states. You also mentioned the need for 150 million people who are in underserved areas, which is incredible, right? So we're a population of 330 million, and just about half are in underserved areas. We can't be everywhere physically, and that's why some of our other efforts are so key and are growing, such as telehealth. We continue, and we've had telehealth operations now for over 20 years, but we continue to try and double down on those efforts. We're partnering with more and more folks that are improving tele opportunities for behavioral. And that includes General Catalyst, by the way, who are doing some great things with technology and with tele. And in addition, we're trying to partner with some of the largest not-for-profit systems, acute care systems in the country, and see how we can work with them to try to alleviate some of the stressors that they've had on the behavioral side, things that maybe they're not as equipped to do on their own. And if we can add a hand in that, and that can be working with current operations that they already have, building new hospitals in their communities, and again, just trying to find areas of need where we can be helpful.
You mentioned the UK. I'm curious, how do the two health systems, the UK and the US health system, compare in the behavioral health needs?
They're vastly different, as you can imagine. The National Health Service aspect of what happens in the UK, it's night and day from what we have in the United States, both on acute care and in the behavioral space. On the behavioral side, The government has looked for outside operators such as ourselves to come in and help in that realm. They are more focused on acute care. They do a wonderful job where they choose to serve patients on the behavioral side as well, but they have had some stressors and some issues over the years. And so they have opened their arms to qualified outside operators like ourselves who are able to help them in a number of ways. One of the biggest other differences is that there are many long stay patients in the UK, whereas we don't have that here. Our length of stay in the United States can be as low as 5 days, whereas there are many situations in the UK where we have patients that have been there for a year or two in a facility. So the way we treat the relationship with the patient obviously is a lot different in that scenario.
COVID also exacerbated the staffing challenges. You have a huge acute care presence. What were some of the challenges that you were facing with staffing? And I'm sure some of those are continuing to this day in the acute care space.
Yeah, I mean, I'll mention both because we were having this conversation earlier, actually, and the folks we were talking to were a bit surprised about this aspect of the staffing issue. We hear a lot about staffing in the overall economy and certainly in healthcare. And most of the time, that's focused on acute care. And our acute care operation has seen the same challenges as all of our other colleagues in this industry. So there's a lack of staff. We're all chasing the same staff, and the rates of pay have increased significantly. What has also happened, but has not gotten much attention, is that behavioral staff has been hit the hardest. And that's because traditionally behavioral staff members would not move over to an acute care setting for a raise of a couple of bucks. It just didn't happen. Those staff members chose to work in a behavioral business for a number of reasons. A lot of them work in that setting because of personal situations, and that's why they chose that. But as the money started to increase so significantly during COVID, the last couple of years, it's something that we've just never experienced before, at least in my 30 years of doing this. So you had really for the first time behavioral staff members that were actually jumping over to the acute care side. And so what happened was there was really no way for us to backfill that staff on the behavioral side. And it's really caused a number of problems that we're still dealing with today and trying to work our way out. The needs of behavioral patients are increasing, but we have less staff. So it's incumbent upon us to figure out a way to service these types of patients without just being in an inpatient or outpatient setting with staff members. And that's where technology, I think, is going to play a big part going forward.
As I noted in the intro, you sit on the board at the Federation of American Hospitals. So this is something that you've been talking with at the national level. What are some of those conversations from an industry perspective on dealing with the staffing shortage in acute care and behavioral health?
Yeah, you're absolutely right. We talk about it a lot. And, partnered with the American Hospital Association, the Federation tries to really just impress upon our elected leaders in Washington just how dire some of these situations are and that we just need some help in working our way out because everybody's affected by this. This is something that touches all 50 states. So I feel like we have made progress in DC in getting people to recognize what the issues are, but a little bit harder in getting solutions to some of these problems, although we continue to work with our legislators and hopefully, we're making progress.
It's mid-December. We're all thinking about 2023. What are some of your biggest goals for the coming year?
I think that as we look to 2023, we're getting further from the pandemic, and hopefully further from some of the issues that we've been dealing with. But that said, as we move forward, it's been interesting and a little bit disappointing that we continue to see such a rocky road in our business. The ups and downs in 2022, while not totally unexpected, were more significant than we thought. We thought we'd have a larger ramp up this year. And I think that you can see across the healthcare spectrum, so many companies and health systems are having similar issues. So for 2023, we're just hoping that the staffing issue starts to settle down a bit, because we know that there are a lot of people that need our services that we want to be able to service and treat, but we can't do so without more staff. And so for us, I think that's really number one. And then number two, as we talk about technology and what we can do, we're very focused on patient safety in both divisions. What types of things can we do on a technology front that can really help assist us in providing more quality to our patients, especially on the behavioral side, with so many patients coming to us, higher acuity patients, more severe situations. We want to make sure that we can help those folks better than we did last year. So that's the focus for us.
Well, Marc Miller, thanks so much for joining us on the checkup. It was a great conversation. Thank you, everyone who watched, and everyone have a happy holiday.
Thank you, Gabe. Appreciate it.